So I think what this really is a perfect segue into doing is, how about if we talk about the cardiovascular and metabolic side effects, maybe in more detail, and find out how do we manage our patients with prostate cancer who are already on androgen deprivation therapy. I, as a medical oncologist, usually prefer to work with a cardiologist or an internist or primary care physician in helping these patients maintain their health.
Right, right. So thank you, Dr. Slovan. You've set up the stage perfectly for me. To introduce myself again as to what it is that I do here, and I'm sharing this podium with an oncologist, so what exactly is a cardiologist doing here today? So I am part of the cardiology service at Memorial Sloan Kettering, and what I represent is a relatively new but a rapidly growing subspecialty discipline, which is called cardio-oncology. As cardio-oncologists, we basically take care of patients before, during, and after their cancer therapy. And one of our main goals is so that patients can get safe and effective cancer therapy in the context of cardiovascular disease. What we don't want to do is trade cancer with heart disease, right? So in the context of this talk, what I will focus on is the primary and secondary prevention of cardiovascular disease in patients receiving androgen deprivation therapy. In the context of cardio-oncology itself, there's a lot more that we do. We participate and collaborate very, very closely with the oncologists and other subspecialists. We monitor for early cardiotoxicity. We manage all kinds of cardiovascular toxicity, whether that be hypertension, coronary disease, heart failure. We provide preoperative assessment for cancer surgery. And we investigate suspected cardiac invasion by tumors, and we help design trials with cardiovascular endpoints so that we don't realize 5-10 years down the road that there was a toxicity signal that we were just too late to pick up.